Well, Gail, it's great to be with you today. And listen, gun violence is a public health crisis in our country that requires a public health solution. And many of us know this. We read and hear about episodes of gun violence in our communities. But I believe that we may not fully appreciate the full extent of its ripple effects across our country. Right now, 6 in 10 Americans are worried about losing a loved one to gun violence. Half of our kids are worried about a shooting in their school. And gun violence has now become the leading cause of death among kids and teens. That was not true a decade ago or decades ago, but it is true today. And my belief is that that should help us increase the urgency with which we're approaching this issue. The good news, Gail, is that there are solutions here. We don't have to live like this. And I lay out a series of strategies in this advisory that can help us reduce the profound toll of gun violence and help recognize that this is an issue that's infiltrated the psyche of America. People are scared in many communities I visit around the country to do normal things like go to school or the grocery store or work, and they're worried about the risk to their life. Yeah, so the good news is there's a lot we can do. There are, for example, community violence intervention programs that we can invest in. There are safe storage education programs that we can expand. There are firearm risk reduction strategies like background checks and other measures that would seek to create time and space between firearms and individuals who would seek to harm themselves and others. There are a number of strategies like this that we lay out that can make a difference here. And my hope is that if we understand this as a kids issue, that we will raise it on the priority list, that we will see it not as a political issue, but as a public health issue that should concern all of us. Well, Tony, it's been an overwhelming response in the last week from parents, from community organizations, and from many young people themselves, who recognize many of the harms on social media to adolescents and want those harms addressed. Look, the bottom line is that we are seeing significant harms associated with social media use among adolescents, and we're living in the middle of a youth mental health crisis. When we recognize that social media has become an important contributor to that crisis, in my mind, that makes it essential for us to take action. And last year, I laid out a series of actions Congress can take to make the platforms safer, to reduce the chances that young people will be exposed to violent sexual content, bullying, harassment, and features that would seek to manipulate their brains into excessive use. Congress needs to take those steps. And in addition, the warning label I call for would make sure that parents know the risks that we're seeing. The fact that, for example, kids who are using 3 hours or more of social media a day are facing double the risk of anxiety and depression symptoms. Well, Tony, it's a good question, and I do feel optimistic, and I'll tell you why. When we look at social media, I have seen over the last year in particular, since I issued an advisory on social media and youth mental health, that there has been growing support among our lawmakers of both parties in taking action to make social media safer. And when it comes to gun violence as well, about 5-6 years ago, for the first time in several decades, we had funding, a modest amount of funding, but still funding that was finally put forward to gun violence research. 2 years ago, we had the passage of the Bipartisan Safer Communities Act, which was the first federal legislation in 30 years to help address gun violence. To be clear, there is a lot more to do. And that's why I've offered the strategies on gun violence and called on Congress to take action on social media to help address the harms to kids. But we've got to make sure that we keep these issues front and center, because fundamentally with both of these issues, gun violence and social media, it's our kids' health and well-being that's at stake. And what's more important than that?